Try doing that, because I've got to
Yeah.
get 3.5.
Keep going, Dave.
Can't we?
Yeah. Right, up
Yeah. Let's go up there.
Up there? Yeah. OK, come on, Trevor, we'll get up there and get this off quick as we can.
There's one thing every PI lawyer knows. Accidents can and do happen. And very often the result of those accidents is chronic pain and suffering and severe financial hardship both for the victim and his family.
In you come, Dave. In you come. A bit higher.
Ah! Trevor! 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 Trevor!
Last year, over 450 people suffered serious head injuries in the workplace. As well as these were the patients admitted as a result of road accidents who had similar injuries. The total cost to society of such injuries runs into millions of pounds.
It's estimated that the number of people suffering from head injury disability increases each year by some 8,000. Of course, the reasons for injury vary widely, as do the types of injury suffered. In this programme, we concentrate on damage to the front part of the brain, the frontal lobes. We first give an overview of the medical condition and care. A neuropsychologist and neurologist explain the functions of the brain, and in particular, the function of the frontal lobes.
Trevor! 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 Ah! Trevor! Ah!
84208, over.
In our case study, Trevor is an entirely fictional character. After his fall at work, he's taken unconscious to the General Hospital. He's transferred immediately to a regional neurosurgical unit. Trevor is employed as a warehouseman. He's 38 years old and married with no children.
When a patient has a brain injury, then the initial assessment, of course, is going to focus mostly on the various aspects of brain function. Often it's the case that the patient has associated injuries, and in some ways they might be of critical importance in the very early phase, so that it's essential to make sure that the patient's breathing's okay, that the circulation's okay, and that's the sort of thing that would happen in the accident and emergency department. Indeed, it would happen at the roadside before the patient reaches the accident and emergency department.
At the early stages, a number of doctors from different specialities may be involved. This ensures that other injuries caused by the same fall are treated. A whole host of complications can arise in the early stages of treatment, not only in relation to the brain.
Patients who are immobilized for any reason are liable to complications like deep vein thrombosis, and the intensive care physician or another physician might be involved in the management of a complication like that. If there was, further investigations like CT scanning might help to show whether a clot had formed. But another complication that can occur is that the fluid chambers within the brain can become distended. Hydrocephalus can develop. Those are very important complications from a medical point of view because each is ultimately very treatable, and on the other hand, without treatment can lead to very serious further injury to the brain or even to death.
The effect of any injury depends on how the brain is damaged, so an understanding of the functions of the different parts of the brain is essential.
Here's the human brain. As you can see, it's divided into two separate halves, what we call hemispheres. So we have a right hemisphere and a left hemisphere. Neuropsychological and other research has shown that one of these hemispheres of the brain tends to be what we call dominant. So, for example, in most people who are right-handed, the left hemisphere of the brain will be dominant. This will be responsible mainly for language, for reading, for writing, and so on. The lobes of the brain, furthermore, are divided into four separate parts. So, for example, if we turn our attention to the brain here, we can see that we have this part of the brain is known as the temporal lobe, and we have a left temporal lobe, and on the right hemisphere, obviously, a right temporal lobe. If we look at the back of the brain, these parts of the brain are the occipital lobes, again, left and right. And above them, and sitting also above the temporal lobes, are what we call the parietal lobes, again left and right. Now these three lobes of the brain, each identically in both of the hemispheres, are responsible for making sense of the world. So for example, the temporal lobes are very much concerned with language functioning and memory. The occipital lobes are very much concerned with vision, visual perception. The parietal lobes are very much concerned with bodily sensation. The purpose of these lobes of the brain is to collect information from the outside of the world, to integrate it and make sense of it. This information then gets passed forward to what we call the frontal lobes. And again, we can see here that compared to the other lobes, these parts of the brain are quite massive. The frontal lobes take this information and try and use it in order to plan, to regulate behaviour, to use feedback to correct behaviour, to deal with unique and novel situations.
In his fall, Trevor's skull is fractured. The damage to the brain is assessed with the help of a CT scan. It shows a severe contusion affecting both the right and left frontal lobes, and a hematoma has formed which needs to be evacuated. As a result, a frontal lobectomy is carried out.
A frontal lobectomy is a neurosurgical technique that involves removing the front part of the brain. This is the frontal lobe sitting in the forward quarter of the brain, and in the upper part, the temporal lobe lies underneath it. So this is the frontal lobe here. And in some instances, the neurosurgeon might have reason to remove that area. Typically, it would be removed because the direct trauma to that area was so severe that that part of the brain had become grossly swollen. And that swelling was causing further damage because, of course, the whole of the brain is confined within the skull, and that's a closed box. If the brain size changes, it no longer fits that box very well, and that can add to the damage that occurs.
The lobectomy will not affect Trevor's intelligence, and in some ways he'll appear unaffected by the operation.
The frontal lobe's function is rather sensitive in a way, and sometimes a frontal lobectomy can be carried out and others scarcely notice that the person's different.
They may function quite well in their own home environment, but as soon as they're placed in a novel situation, a situation they haven't encountered before, it's quite obvious that they have literally no idea of how to plan effectively to deal with that situation. These are called problems of executive functioning.
The frontal lobes deal in some ways with intellect, they deal with emotions, they deal with our ability to initiate, to sustain attention, to plan, and to work towards long-term goals. And if the frontal lobes are removed, then it has effects on functions of that kind. The frontal lobes don't directly have major effects on the movement of limbs, for example. That depends on other areas of the brain.
In our case study, Trevor is transferred back to the General Hospital after the frontal lobectomy. He remains unconscious for 3.5 weeks. When he regains consciousness, he's not responsive to his environment and is unable to form memories on a day-to-day basis. This is called post-traumatic amnesia.
This is a piece of medical terminology which is often used to try and classify the severity of the brain injury. So, for example, it's possible to classify people on the basis of the length of their post-traumatic amnesia. So if somebody has a post-traumatic amnesia, for example, of less than 15 minutes, then their brain injury would be classified as very mild. On the other hand, if it's over 1 day, it's classified as severe, and if it's over 7 days, it's classified as very severe.
The assessment of a patient such as Trevor by a neuropsychologist typically involves 3 stages: interviewing the patient, interviewing a close family member, and giving tests to the patient to try and measure different functions, for example memory or attention span. The results of these tests will be compared with the performance of people who haven't suffered brain damage.
We actually go out of the hospital to a local shopping centre, and we've got a test that we run in this shopping centre where the individual has to visit a number of shops, buy certain items, meet the examiner under a clock at a certain time, and adhere to certain rules. Now that's a fairly difficult task, and most normal control subjects, in other words people who haven't had brain injury, will make some errors on that. But people, because it's an unfamiliar situation, and obviously we have to make mistakes to learn from our experience, people who, such as your case study, who basically haven't got any frontal lobes anymore, would have enormous difficulty in coping with that. I'd expect them to perform very poorly on such a task, and indeed not to follow the rules, not to achieve the task, and to generally perform very poorly.
Lift up and pass it forwards. Come on, a bit further.
As well as cognitive problems, patients like Trevor often exhibit difficult behaviour.
Take the ball from me. So.
I just gave it to you once.
Quite often, such a patient would, in a rehabilitation setting, would be asked to perform some task for the purposes of his rehabilitation, and would simply not have the insight to do that, wouldn't see that as appropriate, wouldn't see necessarily that he had a problem, so why should he do it? Or may respond aggressively, either by shouting, hitting out, kicking out, spitting, or whatever. So these are obviously problems that would have to be dealt with first before we could even begin to get at the underlying cognitive problem and work with that.
Trevor has been discharged from the General Hospital, but he still has behavioural and cognitive problems as well as some physical weakness. He has problems with his sight and is experiencing palsy or paralysis on the right-hand side of the body. To help deal with such complications, some patients can benefit from a stay at a specialist rehabilitation unit, such as the Kemsley division at St Andrew's Hospital in Northampton.
That will give me information about the sorts of problems that you've been having, things like memory, attention, and so on. In a specialist rehabilitation unit, skills can be retrained. So, for example, a patient with frontal lobe problems may have problems getting washed and dressed because they've lost the ability to sequence the individual behaviours together that lead to the end goal of getting washed and dressed. So we would retrain people to be able to perform these skills.
Right. I'll do that.
It's hoped that the treatment will enable the patient to live independently. In our scenario, Trevor is discharged home and lives initially with his wife. However, his behaviour causes considerable strain on their marriage. Trevor's wife continues to be supportive, but she decides to live separately. She also works full-time, so a case manager is employed. The case manager decides on a care regime for Trevor and arranges the smooth running of the household.
The case manager is involved in establishing the right kind of support and care. For instance, recruiting carers, monitoring their input, educating them into the kind of rehabilitation programs that need to be done within the home. The case manager is involved in trying to ensure that the rehabilitation that they have had is maintained within the home situation and progressed on, that people can return to and adjust to a more normal kind of lifestyle. This may involve helping someone go back into the workplace or establishing an alternative kind of activity for them during the day with the kind of support that they need.
As part of Trevor's rehabilitation, he goes to a day centre run by Headway. Headway is a national organisation which provides support for the head injured and their families. One of its aims is to assist people like Trevor in living in the community. It provides a social outlet and encourages productive activity.
They run groups, lots of local groups, day centres, and they have regular meetings where they have different subjects that they talk about. And they provide a valuable resource often from the very early acute stages of when somebody's in hospital to in the community.
Okay, this afternoon we're discussing verbal communication. I want you to look at the sheet in front of you. We're going to discuss each separate area.
Do you want us to mark the sheets?
Not at this stage, we're just discussing it. We're going to see how it relates to you.
It's a valuable resource for the head injured, but I have to say, as a case manager, many of my clients don't believe that they don't like to be with other people with brain injury, so they often won't avail themselves of the resources of Headway because they're not like the others.
Talk it through. Just listen. Am I doing this or what?
You are. Just one
Talk
second,
it
David.
Talk it through.
Case managers can become involved at any stage, but it depends on the funds available, what support the patient has, and the type of injury suffered.
Talk it through, listen, and find out the other. I'm confused now.
That's okay, just there.
Right, now then, Trevor, now that it's going to be much harder for you now because you haven't got your feet on the floor, you're going to have to think much more about your balance. Okay, so
Trevor is not able to work and may need a number of expensive aids as well as treatment, so an application for an interim award should be considered. As Trevor is a patient, the Court of Protection may need to be involved, and we'll consider this procedure in a later programme.
And you managed to keep your hand on as well, that's great. So, coming on nicely with your balance there.
Can I go now?
The experts may suggest a stay in a specialist rehabilitation unit, as in our scenario. The cost of this might be included in the application for an interim award. In that programme, we'll discuss Trevor's final award, looking at the Court of Protection procedure and considering the alternatives to a lump sum payment of damages.